is an important question that we're dealing with today. I learned by talking with people during the conversation and the networking, we all got something in common. Firstly, we don't have a duty, which is good, but we care. We do care about people, and that's what brings us together here this afternoon. I also noted that there were several people that already know about silica dust and the campaign. I'm not the one who like to promote commercial TV, but this 60-minute doco and program actually gives a very good background on the problem of the silica dust and the campaign to eradicate it. So I recommended that you Google search and watch it. It is very informative, and there are many things that we take for granted that it is there. In general, we always, even when sweeping, we inhale dust, but there is this particular particles of dust that are quite dangerous. The CFMEU, together with other unions and the ACTU, launched a campaign calling for an urgently regulation or inaction to ban engineered stones amid the number of silicosis cases that have become an occupational lung disease caused by breathing the crystalline silica dust that causes inflammation in the lung and fibrosis that eventually become fatal. So we do have a number of these workers that are suffering from silicosis, and the difference together, we talk about some similarities with asbestos, for example, is that with asbestos it took a very long time. With the engineered stone, it has been very fast developed, and we do have workers as young as 30 suffering from silicosis. 1 in 3 stone workers in Queensland, for example, have been tested positive to the potential fatal disease. So it is a big issue, and despite that there is a little bit of general knowledge out there, we do need to have some sort of action. The scale and scope of the problem requires immediate health responses, including, for example, the establishment of a national dust disease register and mandatory reporting. The expanded health screening programs conducted by properly trained medical professionals, the establishment of a compensation fund, and adoption of the 2015 Western diseases list amended to cover all the silica dust diseases. Last Saturday, the CFMEU youth, and I've got my colleague JB here with me, on a national basis, we have an action outside Bunnings warehouses, and this in Perth. We targeted Balcatta and Cobham, and the reason we did was Bunnings is refusing to ban the manufacturing and the sales of engineered manufacturing bench tops. What I noted was a very good reception from customers. In general, despite stopping to see the dinosaur and the kids playing with it, it was that people have listened to some of the information on the TV, on the news. It has been out there in general, and they prepare, in my view, to pay a little bit extra for a better product. That's what we witnessed, and then we saw a handful of people that didn't care in general. Probably the type of people who wouldn't care about anything else. But people who came and buy a bench top can do it themselves, and that's good. Or they get an installer, for example, to install a vanity or a bench top. It is perfect if it fits, but if it doesn't fit, if it is by 2 millimeters, you have to sand it or grind it, or if it is by 2 centimeters, you have to cut it. And often, in domestic setups, you won't have to have those facilities. can be as simple as wetting the material. But what we see in our investigations and inspections of workplaces in Perth has been that there have been shortcuts. They haven't implemented the elimination in the first place of the dust. They haven't introduced measures to prevent workers from being exposed. And what we have seen, particularly in some of the small workplaces in Balcarra, Westport, or Kona, is that the small workplaces with a lot of non-English speaking background workers, without any PPE, without any safety regulations or any safety implementation. So they're really there for profit and trying to, to comply with the requirement of the industry. I think that we can do better, and my union believes that it's possible to do better. In this sense, the definition of what products have to be banned will be aligned with the Victorian crystalline silica regulation, which states that engineered stones means a manufactured composite stone material that contains resins and 40% or more silica, crystalline silica. The public campaign, we focus on 3 areas to eliminate silicosis risk for workers. One, in the workplace safety, and this, our safety reps play a very important role. The training and education that us in the union movement and also in the workplace, people who have the education and the awareness of this can help to implement. And the consumer choice, like I mentioned, there was a very good reception outside the Bunnings workplace, places that we targeted, and people will be prepared to pay a little bit more to save a life. I haven't seen any person that will say, listen, well, I don't care, has nothing to do with me, I've already got a kitchen or anything. Everybody will have a relative, a husband, a son, a daughter that will be exposed to this type of risk in the workplace. And also the change in the policy. We know that there are conversations at the moment and some commitments made by the ministers. They have got together, they have been talking about this, but they have to make a change. In the CFMEU, if a ban on the importation of these engineered stone products doesn't happen, we're going to do it. We're going to ban it from the 1st of July 2024. And to do this, using our industrial muscle, using our awareness, using our structure, our delegates, our safety reps, we will need public support. And in this, people can participate. Currently, we have a website of the killerstone.com.au, but also Australian Unions .org.au, currently a petition which had about 10,000 signatures to it. I encourage you to do a little bit of homework during the break or after the conference today to log on to the website, to do your own research and to help to ban this killer stone. The public campaign, as I mentioned, we play a role in this. We'll be targeting the workplace safely, the consumer choice, changing the policies. What are we asking? Firstly, to ban the use of engineered stone from the 1st of July 2024. Ban the importation of engineered stone products from the 1st of July as well. And introduce mandatory accredited silica awareness training nationally. So there is very small steps that can be implemented. It requires political will. It requires people's participation. The experience have shown that, alongside with the asbestos campaign, it took a very long time. For 50 years, the companies knew about the dangers of asbestos. They tried not to spread the word about creating any public awareness about the dangers of asbestos. Eventually, people and union participation help in this change. We got now 20 years, a milestone that we're going to hear from from the Australian Disease Asbestos Society later on this. But it is possible to achieve change. It is possible by being organized, by having collective action, and in particular safety reps will be more protected. When what they do, when they exercise your right as safety reps, you get the support of your co-workers. That is your best protection. Not really what is happening that you expect that we come with the regulator will come in and protect you. Like we hear reports, many of the pins implemented, even if they're not properly made, then they don't get the note. So it is important that workers, safety reps, get engaged, build your base in the workplace, so you are protected, your workers are protected, and we have a safer workplace. The campaign update at the moment, and all of this can be found on the website as well, is that the Work Health and Safety Ministers, as I mentioned, met in February 2023, and unanimously I agreed to explore the deadly impacts of engineer stone on workers. The CFMEU pledges to keep fighting until the engineer stone ban is implemented. If the government doesn't carry it through on banning engineer stone, the union will. July 2024 remains our deadline. So often we have to do things in this way. We have to do it in this way, and we are confident that we got our member support, workers in general support, and I can tell you many of the public is supporting this decision by the union. It is a big step forward in the campaign for protections from silicosis. The ECTU issued also a media release at the end of February this year, and as I mentioned, there is the website australianunions.org.au, which also carrying this petition. Workers suffering from the deadly silicosis today welcome this as a major step forward in the campaign. For many of those workers, tomorrow is too late. Many of them are dying, like we saw in the video at the beginning. It is such a difficult disease that makes breathe very difficult for people, and in the end, most likely than not, people die. So we go to make silica history, just like we did with asbestos. Unions have played that very important role historically. It is possible to achieve change when we work together. And in some of the contributions, I think there was Alexei when he spoke about the density of union membership. It had been in decline to about 1 out of 10 workers belong to unions. That has to change. Our occupational health and safety has become weaker, our workplaces have become more difficult, and life for workers has become more and more difficult with wages and conditions because union density has dropped. That has to change, and we all can be participants in that change by talking to our co-workers in the first place, by creating awareness of the power of the collective, that together we can make change, that together we can achieve a better future, a better workplaces for all, and a safer. So in these unions, you might recall that 20 years ago was very noticeable in the James Hardy campaign against asbestos. The CFMEU played a very active role in this. The company knew it 50 years before that it was dangerous. Today, Caesarstone, based in Israel, the news since 2006 that the engineered stone causes silicosis. But what these companies do in the end is they try to hide it from the public, from the workers that work with them. And for example, in the case of Caesarstone, introduced a very small label saying that it was dangerous with a fine print on it. So it's all of this plus the power of the money to try to hide the reality. So we're talking on behalf of our members, on behalf of workers that today are suffering, and on behalf of our workers that came after, that today need protection and the only protection is to eliminate the cause of this deadly disease, and the elimination is to ban engineered stone forever.